everyone, I'm Jill Nicolini, and I'm excited to be here working alongside Dr. Stephen T. Greenberg, and I'm here today in the office with him, excited for a little interview, a little Q&A session. How are you feeling today?
I am great. Right in between patients. We just did a whole bunch of operations today. Now we're heading into office hours to see consults and injections and all sorts of things.
And of course, he always has time for his patients and people out there on social media. You all are writing in all the time, and we are listening, and he's here to answer some of your questions. First and foremost, let's start with this one. Can you get Botox after getting a facelift?
Absolutely. So Botox in combination with facelift is super common. Now let's just talk a little bit about facelifts, because we get a lot of questions about this, and I do a lot of facelifts all day long. Every facelift is different. We individualize this process. Sometimes it's a full facelift. Sometimes it's just a little neck or a little jowl, or what I call the mini or micro mini facelifts. Fitting the type of facelifts to the person is so important. Now, Botox. Botox gets rid of the wrinkles, forehead, glabellar, crow's feet, and a couple of other areas. So yes to Botox plus facelift is great. And there are other things that I also do with facelifts. I often will laser somebody to get rid of fine lines or wrinkles. I often put a little fat transfer in. So it's really about making each and every person look great or individualized.
Individualized and customized right here at your service he is. All right, we have plenty more questions, and this one says, do you place the implants over or under the muscle?
Okay, so breast implants, like faces, individualize this process, figure out what the patient's anatomy is. We do a lot of computer analysis and things like that. Typically, my implants go underneath the muscle. I typically like to use the silicone gummy bear implants because they're softer, they're more natural. They really do well long-term as well. So under the muscle, and a breast implant only takes about 20 to 30 minutes. That's it.
Wow, that quick?
It is quick.
All right, I've had both. I've had them over the muscle originally when I was younger, and then you put them under the muscle, which I prefer to say I like for my body. So thank you for that. Okay, what's the difference between a lip lift and lip filler?
All right, so there is something called a lip lift surgically, where we make an incision underneath the nose and pull the lip up. There is also lip filler, where we just make the lip a little bit more plump. I often get a little bit of a lip lift with Botox as well. So it depends on the person's anatomy. A surgical lip lift is done in somebody who has a really long distance between their nose and their lip, and their lip is kind of inturned. But if we want to turn it out a bit, we can use filler, or we can do a lip lift.
Do people do like lip implants like the old Lisa Rinna look anymore?
Not really. Instead of doing the lip implants that we used to do 20 or plus years ago, we typically are using lip filler for that.
Good. All right. Thanks so much. Now, let me ask you about how much fat can you take out with liposuction?
So liposuction, Jill, is one of the most common cosmetic surgery procedures in the United States. Breast implants and liposuction, two most common procedures. We can take out up to 5 liters of fat. Now think about it, that's a lot of fat.
Wow, it is.
And each one of those big Coke bottles is 2 liters. So this is 2.5 of those. 5 liters of pure fat is what we can take out. Often patients don't need that much. We do little areas, and we don't have to take out that much fat.
All right, well, how do fat bags under the eyes form, and how can we get rid of them?
Very common. Fat bags under your eyes excuse me, are common and get worse as we get older. And it's the fat that was always there, but now tends to protrude as the kind of the wall that kept in the fat loosens, and now you have that little fat pocket. What I do is I go from the inside, I turn down the lid, I pluck out the fat, and it's smooth forever.
And you just did our friend here, Jocelyn, at the office, which, by the way, she's looking and feeling great already.
Yeah, not bad after she's just like 4 or 5 days. All that fat is gone. When you do the upper eyelids, I make an incision in the crease and remove the extra skin. But for the lowers, it's done without incisions, and you're flat there forever.
All right. Also, some people want to know, after they have liposuction, a lot of people say, hey, I also want a fat transfer. Where on the body can you transfer fat to?
Most common places to transfer fat, number one, the butt, which is called the Brazilian butt lift. So we take the fat out, abdomen, love handles, legs, wherever it comes from, we put it in the butt, or that hip dip that sometimes people have. And then other places like the fat into the face works well. fat into the breast if you just want a little bit of a increase in volume, but not too much. So those are the areas for fat. There is a new fat made in the laboratory now as well called alliclay. Now, alliclay,
Never heard of this.
Yeah, it's actually purified cadaver fat, which we can use for the face, we can use for the butt, we can use in different areas.